Hello, everyone. This is the final team project in the topic number 3, the diagnostic of the COVID in 2020X. Our name of project is the diagnostic quality improvement using the CT scan in low-dose protocol combined with the AI to integrate the accuracy of the COVID-19 diagnosis scheme. This is Janice and Shin Soyeon. Let's get started. For the content, I will talk about this kind of the topic in respectively, start with the background and end with the impact. For the coronavirus 2019, there is the infectious disease caused by the SARS-CoV-2 virus. And the most of people who infected with this virus will have the experience about mild to the moderate respiratory illness and can be recovered without requiring the special treatment. But someone becomes seriously ill and require the medical attention, especially the older people and those with the underlying medical condition. But however, anyone can get sick with the COVID-19 and become seriously ill or die at any age. For the virus can spread from infected person by mouth or nose, by the aerosols or the droplet, or even the feces and excrement, and can transfer direct person to person within the range about 1 to 5 meters and spread into the social contact in the public area and the transportation, or the indirect media to the person, like when you touch the droplet and you breathe the droplet into your body. It can also contact as the direct person to person. For the computed tomography and the artificial intelligence, the computed tomography or CT is a non-invasive medical examination or procedure that use the specialized X-ray equipment to produce the cross-sectional or 3D images of the bodies. For the cross-sectional images are used for the variety of diagnosis and therapeutic purpose. And how about the AI or the artificial intelligence? Is referred to the simulation of human intelligence in machine that are programmed to link the human and mimic their human actions. For the significance of the COVID-19, in the COVID-19 detection can be done in various methods, like the real-time reverse transcription, polymerase chain reaction, or RT-PCR. They need to examine in the laboratory or even the antigen test that can perform in initial examination by oneself. But for the RT-PCR, it's too complicated and partially expensive. So some patients who do not have the access to the RT-PCR, they have to require the alternative test, which less accurate and it can lead to the inaccuracy of diagnosis. Then the importance of the diagnosis COVID-19 is if we can interpret this precisely and accuracy, it will be allow the patient to receive the treatment fast and reduce the chance of spreading the COVID-19 virus to the others. For the goal of this research, we want to improve the qualities of diagnosis and accurate the outcome so that the infected people and patients or the others who related with this work will have a better quality of the life after being diagnosed quickly and to lead to the appropriate and timely treatment is. About the approaches of the COVID-19, in the screening process of COVID-19, CT scan imaging becoming the early step of the detection and diagnosis. Our study focuses on the computed tomography scanning technique by adjusting the protocol using to scan the patient, the COVID-19 patients in low-dose technique to reduce the amount of radiation dose that the patient receive. As you show here, this is the ordinary CT images that used in the COVID-19 patients show the severe of the lung in their patients. But however, as we know, the CT is not only the method for COVID-19 diagnosis, but we also take the AI or artificial intelligence used with the medical imaging equipment to improve the diagnosis of infection and detection capabilities. As you see here, we use the AI for provide the most accurate and fast diagnosing. At the left side, this is original CT scan, and the right side is show the original CT scan using with the AI in red color.
In the COVID-19 case, among the patients confirmed by RT-PCR test, computed tomography imaging finding shows abnormal findings such as ground glass operation or patch operations. In this way, we could think that CT scan technology is correlate with COVID-19. At this time, CT technology is already in the trend of being commercialized by being combined with deep learning. However, the cost is higher than the number of sick patients, so doctors do not use it well. Therefore, we believe that combining this technology with COVID-19, which has a large number of confirmed patients, will compensate for the huge number of medical personnel currently being treated, resulting in a great cost effectiveness. Therefore, we thought that combining CT related to COVID-19 with artificial intelligence and machine learning technologies would make diagnosis more efficient in a situation where countless people around the world are confirmed to have COVID-19. In addition, increasing the diagnostic efficiency of doctors can also be expected to reduce the number of deaths by focusing more on patients with several diseases. If the first step planned by the researcher fails, there will be a problem in collecting data used in the study. In this case, researchers should adjust data collection criteria similar to existing plans or change them to collect data using other diagnostic tools or methods. For example, if the number of data we planned is too small, artificial intelligence cannot provide good data to doctors. In this situation, you need to find other AI models or collect more data for better research. If COVID-19 is combined with AI in this way, the patient will be able to receive faster and appropriate treatment. If treated quickly, the patient can be prevented for deteriorating and additional scrutiny will be possible before the disease progresses further. In addition, since treatment is performed after diagnosis with a higher level of accuracy, it can be prevented from receiving excessive prescriptions or serious procedures than the progression of actual disease. In addition, medical standards may fall due to limitation of equipment and medical staff in outer areas where doctors are insufficient, and it is expected that inequality in the medical system can be solved by quickly filming only CT and sending information to medical staff in the city. Thank you for your attention.